Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
One of us is a little more famous than the other, but I won't say which. Okay, today we're going to talk about spondylolisthesis and what it is and basically how to treat it. We actually are lucky here in a sense that we have someone that actually has spondylolisthesis. So Brad's been dealing with it for quite a few years here, and you can give kind of your personal experience and how to treat it, how you've been treating it.
Yep, first-hand experience.
Yeah.
It's a mouthful, you know that name.
Yeah, it is. I'll put it on.
Sure.
Sure.
It's been around, you know, they've known about it for a long time. Discovered in 1782.
On you?
No.
Oh.
Bob, why?
Okay.
And it was named actually in 1854. And actually what it is a Greek term, and it means vertebra slipperiness. In other words, the vertebrae are sliding on each
Oh,
other.
that's appropriate. I mean, it really is.
It is,
That's
right.
That nails it.
Yeah, and so we're going to look at what is spondylolisthesis or spondylolisthesis, and we're going to look at, on here, you look at the vertebra, the lumbar vertebrae, where it typically happens, and usually the lower ones between L5 and S1, and in my case it's between L4 and L5, and we've got a little problem. I'm going to...
Your pen's right over there, Brad. Why don't you point?
Okay, yeah, my pen. The pointer pen. Okay, we're going to look at this vertebra and this vertebra because the pelvis gets in the way. And what happens is this vertebra is going to slide forward like this, okay? And it's really weird. The first time I ever saw it, it's like, man, that's going to really mess up the nervous system, and you got the spinal cord and your peripheral nerves, but it's amazing how the body adapts, and it really does quite well in general. So let's look at what x-rays look like of my back. These were taken in October of 2013. Okay, if we look up here, we got L2, L3, L4, L5, and here's the x-ray. And if you look at, I got them highlighted so it's more clear. L4 is shifted forward. You can see the step. And actually I have no disc there. The disc has degenerated away.
Show the normal disc space here.
Yeah, there you go. Here's a normal disc space between the vertebrae, which is good. Nothing there. The good news is I can't get a herniated disc there. That's what I always like to say. And the space here is all messed up as well. Okay, so what kind of symptoms are you going to have if you have spondylolisthesis? Well, generally low back pain, and it can be chronic, can go on. I had a backache for about 2 years. It didn't keep me out of work or anything, but it was just a pain in the back, and it's, depending on what I do, it would either get worse or get better. And I learned some exercise to make it better. First of all, you'll find that if you like go shopping or standing still in one spot, just standing there. And just last year, I was serving brats at Oktoberfest for 2 hours straight, just standing there. My back was killing me. I knew it was going to hurt, but what could I do? I had to finish serving the brats. Sure. These people are drinking beer, they want brats. But that gave me a bad backache for a week.
If I interject, Brad, generally if you're standing there, if you can put your foot up on something, would it not help a little bit?
It helps. Yeah. It helps if you just sit down and
give it a break.
Right.
The other thing is, like, we used to tell people who are working at a sink to open the cupboard door below the sink and put your foot up in the in the cupboard.
Right.
Just
you'll know because it'll be immediate relief. You'll say, "Oh, that feels better."
Bring one foot up, another foot up.
Right.
I mean, you need to find the positions that'll help give you the relief.
In general, with this condition, this kind of activity, working overhead, is something you do not want to do. It's going to irritate it. It's going to get sore.
Putting the back in extension.
Right.
Extending the back.
If you'd like to go to another video that I have a complete set of exercises that I use on a regular basis and have been successful with me, especially over the last 2 to 3 or 1 to 2 years since I've been doing them. Much more activity. I'm running again up to 3.5 miles, which I wasn't doing for a while there at all, which I really liked to run.
You had stopped running.
Right.
You were just biking.
Yeah, and I think that's when it shifted. But anyways, there is a complete video on that, Bob.
I will link that.
Okay.
Right up here.
Right. So the whole idea is you need core strength. Where this is shifted forward, you need to have like that back belt, but don't put a back belt on. Strengthen your muscles, and they should be done in a position that makes you lean forward, not backwards.
Sure.
Okay.
Makes sense.
So, and the other good news is there's just a study that was a coworker of mine read, is that the majority of spondylolisthesis, once they fuse into place, they do not move again.
Is yours considered fused? would they say, or not?
Well, it's in that direction. It looks like there's
It looks
some
like
bone-
it's close.
Right,
I
the,
mean, it
the
looks like
bones
there's
have
no-
fused.
Yeah.
And in general, I'm better, much better than I was a couple, 3 years ago. But again, your body will tell you if it's
Right.
hurting. You
It's
know?
amazing how the body adapts
Right.
to these things.
I
so.
can walk 3/4 of a mile consistently before my right leg starts to go a little numb. And then I need to sit.
That still happens.
Right, that still happens.
But
But,
yeah,
I
you-
can run 3.5 miles, it doesn't bother me at all.
Isn't that crazy?
But I had to change my running style, that's another
Oh,
story.
So, all
So
right.
if you've got that diagnosis, don't get over concerned, watch these videos, you're gonna be helped.
All right.
So subscribe.
Yeah, do that subscription thing.